Good morning, Miss Sherry. I have here my hands. Okay. Okay. So I have here my case scenario, and I have here meds and stuff. So here for the scenario, so I have a 77-year-old male who is on acute care after a fall from bed at home, resulted of fractured right hip. He is currently awaiting hip replacement surgery after receiving a PRN dose of PRN at 6 o'clock. The client reported a pruritic urticarial forming on his forearms bilaterally, a rash. So the client has a past medical history of type 2 diabetes that is being treated with insulin. So I'm required to administer his 7 o'clock medication. So today's date is 25/2020. The current time is 6:05. So I'm going to check the accuracy or the competencies of the physician's order to the MAR. So I've checked here for the order, physician's order. We have the Himalayan R10 unit sub-Q 3 times a day with meals, the morphine 5 milligrams 1 m every 6 hours as needed, diamine hydronide 5 milligram IM every 6 hours PRN, and we have a normal saline at 150 ml per hour by Dr. Peter. And also we have a physician's order as well of diphenhydramine 50 milligram IM every 8 hours, which we start now by Dr. Peters as well. So I have here the patient, Mr. Henry Hill, a 77-year-old male, date of birth October 4, 1943, page and number is 423214520. He was diagnosed with fractured right hip, and he doesn't have any known allergy. So I'm gonna check the MAR for completeness, and I'm gonna compare it again here over here. So I'm ensuring the client's name, which is Henry Hill, the date of birth October 4, 1943, the page and number, which is 423214520. So it's accurate. So also he doesn't have any known allergies. Okay, and diagnosed of fractured right hip. So I've checked that the order and the MAR are accurate. So I'm gonna perform hand hygiene. So I've done my research. So for the medication that I'm gonna give by 7 o'clock, we have here the diphenhydramine 50 milligrams IM every 8 hours, and we also have the Himalayan R10 unit subcutaneous 3 times a day with meals. So we have here the diphenhydramine. So as I can see, that generic name of the generic name is diphenhydramine HCl. Brand name is Benadryl or Dormex. Classification, it is an antihistamine. The action of this is to works by blocking the histamine that the body makes during an allergic reaction. So this is accurate with the patient since he had the morphine shot, he had an allergic reaction to it. So we'll be needing this one. And this is also to treat allergy symptoms, cause nausea, vomiting, and dizziness caused by motion sickness, as the patient reported a pruritic urticarial forming on his forearms bilaterally. So it is contraindicated for newborns or some premature infants because there's serious some side effects. It is also a hypersensitivity to histamine who are hypersensitive to histamine. So for children who has common colds, like children who is less than 6 years old, they have a serious side effects such as slow or shallow breathing, and it also for pregnancy or who had a hypertension, so we don't want to give them. So the safe dosage for this one is, so we have here an adult patient. True IM is 10 to 50 milligram, while maximum would be 300 milligram per day. So I'm giving for the diphenhydramine 50 milligrams, so we're on track. So side effects for this drug is some drowsiness, dizziness, headache, constipation or some blurred vision, also a dry mouth or stomach upset. And for the pharmacokinetics, so it is So this is metabolized in the liver, so that it is excreted by the kidney. So as you can see, it is really contraindicated to pregnancy or who has pregnancy because it is excreted to the breast milk. So once it is ingested by the infant, there's some serious risk for it. So the onset of this one would be an hour and a half. Peak could be 2 to 4 hours. Duration would be 48 hours. And we also want to assess the respiratory status of the patient, the rhythm, any increased bronchial secretion, some wheezing, or some chest tightness for the patient. We also want to assess the if he has a frequent urinary retention, or so that we should know that the product should be discontinued. So we want also to evaluate some rash, and also we want to teach the patient to avoid driving because drowsiness occurs. Also, we want to avoid them drinking alcohol because CN is depressant, and we also want to allow them to eat hard candy or some gum just to make sure to prevent dry mouth. And also, we would like to tell the patient's family or the patient to notify the prescriber any hypotension or confusion or sedation that may occur. Same thing as well with the insulin. So insulin, we have the generic name in Humulin R. Brand name would be insulin regular. So classification, it is an anti-diabetic. So it is used to control high blood pressure in people with diabetic. For example, this is my client who has a type 2 diabetes. So he's dealing with the insulin. He needs an insulin. So the action of this is to decrease the blood glucose level. So this insulin replaces the insulin in our body that normally we would make. So it is a short-acting insulin. Works by helping the blood sugar get into the cells of the body that the patient can use as an energy. So it is contraindicated who is allergic to insulins or who has a hypoglycemia or low blood sugar. So the safe dosage for this one is medicine within 30 minutes before starting to eat or insulin. So Humulin R starts lowering blood sugar within 30 minutes of infection. So pharmacokinetics, so it is a short-acting insulin. The onset is this at 30 minutes. Peak could be 2.5 to 5 hours, and duration is up to 7 hours. We would like also to consider some nursing considerations, such as like assessing the hypoglycemic reaction during the peak time within 2.5 hours to 5 hours, such as some signs and symptoms of sweating, some dizziness, headache, some confusion, rapid weak pulse, or a slurred speech when you're talking to the patient, or anxiety or hunger. We might also want to limit alcohol taking during this medication because it increases the risk of developing low blood sugar. And we also want to educate the family or the patient to recognize as well the hypoglycemia reaction, such as frequent urination, thirst, any fatigue or weakness or hunger. And also that we would like also to inform them that blurred vision may occur during taking this insulin. Okay, so upon before administering this kind of drugs to the patient, the Humulin R and the diphenhydramine, we would like to assess for the vital signs, especially the respiratory rate. We would like also to assess the blood glucose level, and the level of consciousness of the patient as well. So let's go with the first check. So I have here 2 vials, here the Humulin R, and I'm using the heparin as the diphenhydramine. So for the Humulin R, okay, this one, and I'm using heparin again. Sorry, I'm using heparin for the diphenhydramine. So I'm just gonna check the Humulin R. So I'm gonna check for the expiration date, which is 05/12/2040. Okay, so I'm checking also the patency of this drug, which is there's no crack or something that would not allow me to grab some meds here. Okay, so this is all good. And next, I'm gonna check as well for the patency of the diphenhydramine and the expiration date. So diphenhydramine, okay, so I have it here, 50 milligram per ml, HCl, expiration date would be 5/12/2040. So it's all good. There's no any sign of crack or something. Okay, all good. So I'll be giving insulin and a diphenhydramine. So I'll be giving insulin because it is a prescribed. So I'm giving insulin just to treat the type 2 diabetes of the patient. I won't be needing any combination something because I'm just giving a regular insulin. And so I'm just gonna start grabbing some meds over here. So I have here my alcohol swab. I'm just gonna show this one. Swab this one right over here. And I want to make sure I won't touch that one since it's already sterile. I have here my inside insulin injectable syringe, 1 ml. Okay, so I know that I'm grabbing 10 units of it, so I'm just gonna withdraw 10 units of air. Oops. And I'm gonna grab, and I'm gonna insert it over here. Okay, and withdraw 10 units. So making sure I have no bubbles or something over here, so I'm just gonna tap. There. So since I'm not using it, I'm just gonna recap for a while by using a fishing technique right over there. So we got 10 units of, I don't know if you can see it though, there, 10 units of insulin Humidor. So I have here some, just in case for me to know which is which, I'll just kind of put it over here. And next thing I'm gonna do is same thing with the other one. So I'm gonna grab a 50 milligram diphenhydramine. The first thing I want to do is to swab the vial. Make sure I won't touch that one. Okay, so I have here a blunt needle right over here. Just open that one. And 1 ml syringe. Oh, but before that, I'm gonna insert air. So we need 0.50 milligrams, which is 0.5. Okay. Insert the air and tip it over. Make sure there's no air coming in. just gonna remove that one. Oops. There. So make sure. Okay. And I have here my needle that I'm gonna use to make sure these ones will be on a sharp container. Right over there. And I'm gonna label as well. So I have here 0.5. Oh, sorry, there you go. Of the diphenhydramine HCl. So labeling, I have here the name and then the kind of drug I have here, the name of the patient. I'll just set it aside for a while. And this will be garbage. Okay. So next I'm gonna do is a third check. So I have here my prepared meds already. The human are in the diphenhydramine. So I'm gonna check the medicine to the MAR. Here. So I have here the diphenhydramine. So I'm giving a diphenhydramine 15 milligram IM every 8 hours. So I have here 15 milligrams. Here, all good. And insulin, Himalayan R, okay, 10 units, subcutaneous 3 times a day with meals. All good. So before this one, I'm also, as I asked you to kind of look at it, so making sure like you have the right amount, right dosage of this one. You have to ask somebody to check it for you. Ensuring like you have the right medication and dosage. So verified. So I'll ask you to verify it. Okay. So next I'm gonna do is the cleanliness. So I know that my patient has the I have the right client, which is Mr. Henry Hill, and I have the right medication, which is diphenhydramine over here, right dosage, which is 50 milligram, and right route through IM, and the right time at 7 o'clock, and also the right reason, which is to prevent allergic reaction, and right education to avoid probably driving and to drowsiness, because drowsiness occurs when given this antihistamine. And also have the right to, the client has the right to refuse for medication, the right to document. After everything that I've done, I have the right to document. The right evaluation, like evaluating the respiratory rate of the patients upon giving the diphenhydramine. And same thing with the insulin, the Himalayan R. So I have the right client, which is Mr. Henry Hill over here. The right medication, so Himalayan R. Right dose, 10 units. Right route, which is subcutaneous. Right time, 7 o'clock, 2 times a day. And the right reason, because my patient have type 2 diabetes, so he's using he has a history of type 2 diabetes, so he's being treated by insulin. And right education, any blurred vision might occur, so just to make sure, we'll let them know, and then to eat some snack when he feels hunger or something. And the client has the right to refuse, right documentation, and checking for his glucose level as well, and right evaluation, so glucose level. So I'm just starting with the subcutaneous injection. I'm just gonna set this aside. So I'm gonna do perform hand hygiene. Oh, sorry, I'll be needing that one. So identifying the patient by his name. So we have here Mr. Henry Hill. Mr. Henry Hill over here, and the date of birth, which is October 4, 19. Sorry. So good morning, Mr. Good morning. I'm Erica Ramiro, study nurse for today. So today, Mr. Henry Hill. So today, I'm gonna inject 2 meds for you. We have the Hemoglobin R for insulin, insulin for your type 2 diabetic, and your type 1 hydramine for your allergic reaction, to prevent allergic reaction. If you have any further do you have any further questions about it regarding your medications and stuff? No? Okay. So I have 2 meds over here. You'll feel I'll poke you twice. One in your tummy, and the other one would be on your ventrogluteal, would be on your left side, because you have a fractured right hip. So I'm just gonna insert the ventrogluteal on the left side. Okay, so before we start, I'm gonna perform hand hygiene. I'll start with subcutaneous and down gloves. So I have here my gloves. So here I have the injected pad and the alcohol swab. So I'm making sure in the abdomen. So since I'm going to the Hemoglobin R first, subcutaneous, I have to check for the skin integrity. If there's any redness or some swelling and inflammation, I should be aware of it. And so next I'm going to do is to find the area where I can inject it. So not near like 5 centimeters for the umbilicus. So I'm just gonna cleanse the injection area. Oops. So waiting it to dry up, since it's a injected pad, I want to make it for dry. So making sure if you're injecting Hemoglobin R, I will pinch one, and I have it here. So I'll inserting as 90 degree or 45 degrees, doesn't matter. So I'm pinching the right amount of skin and then injecting it. Okay, and then I'm just gonna assist and slowly inserting the meds. So I want to make 10 seconds for it, and then before rubbing it. There. And then sharp will be on the sharp dispenser. And I'm gonna apply a small pressure. I don't wanna, just a small pressure. I don't wanna massage it. Just applying this pressure. That's it. I'm going to throw this one again. Okay. So next I'm going to do is the intramuscular injection. I have here the type 1 hydramine 50 milligram, which is Mr. Henry Hill. So before doing it, so I'm going to assist the client to its desirable position. So since I'm giving it in the ventrogluteal area, I'm going to assist the client in a lying position, and I'm gonna ask him to face me over here. So I'm gonna insert it. I'm gonna administer it on the left hip of the patient. So I'll do a ventrogluteal one. So making sure the landmark is over here and body promises, and then to the muscle. So left side. So since this is a small injectable, so I have to do Z track, but I'll just do it this kind of way, so it'll be easier. But before that, of course, I have to assess as well the skin, the integrity of the skin. If there's any redness, some swelling, or some lesions, I won't inject on that one. So since it is all clear, I am good to go. So also I'm gonna wipe the area with alcohol swab right over here. So since it's already clean, I don't want to contaminate it. And I have here there. So since C-track, I'm just gonna use this one over here, palm over there. to support it, and this one. So I'll do a poking of 90 degrees. So Mr. Henry, you can feel, you'll feel a little bit of sting over here. So if you want to make, just let me know if you feel uncomfortable with position, okay? So I'm gonna insert it, Mr. Henry Hill. There we go, 90 degree, support the needle, and slowly inserting the medication. And I'm going to leave it for 10 seconds. And pull it up, and then to the sharp dispenser. And also I want to apply pressure, don't massage it. And that's it. So safely I'll remove my gloves over here, and then I'm gonna assist the patient to its desirable position. So any semi-foulers will be good. And then are you good with your position? Okay, you're good. So do you have any questions or something? But before leaving the patient, I have to stay for a bit, probably a couple minutes, just to ensure that my patient is well, so that she don't have any I'm gonna observe any allergic reactions and stuff, any signs of confusion, some headache. So I'm gonna stay here for a while. Okay, so Mr. Hill, our job here is done. So if you have any more questions, I have your call bell on the side. Just press it if you have any questions about that. Okay, thank you. So I'm gonna do hand hygiene as well. Perform hand hygiene, and after that, I'll do documentation. So I have here documentation. So since I've given my medication at 7 o'clock, I'm gonna document over here 7. Okay, so ER, SBN, and also for the Himalayan R, ER, SBN, and also the glucose level. I'm gonna check for that one. So let's say it's on 6. So kind of in the normal range. To document all the proper medication, the MAR, so any narcotic that I give, which I didn't give anything, so just the insulin and then the diphenhydramine. And evaluate also after like probably half an hour to make sure the client is all well and he doesn't have any complications and stuff. He doesn't have any allergic reaction, and he has a good blood glucose level. And that's everything. Thank you, Ms. Sherry.